Community Partner Spotlight is sponsored by RBFCU.
Good morning and welcome back to We Are Austin. Each month we highlight a local organization and the services they provide to our community for our CBS Austin and Telemundo Austin Community Partner Program. For February, which is Black History Month, we've teamed up with Black Men's Health Clinic. Here today to tell us more are founders Dr. Larry Wallace Jr. and Larry Wallace Sr. Good morning to you both. Thank you so much for being here today.
Well, thank you for letting us be here.
Yeah, we love our Community Partner Program and the fact that you have teamed up with us this year. You're relatively new. And Mr. Wallace, can you tell me more about the Black Men's Health Clinic and your mission and the services that you really provide to the Austin community?
Thank you. The Black Men's Health Clinic was established a year and a half ago, and our purpose is to address disparities that Black and brown men face. And we're here to bring solutions and remove those barriers that they experience.
Yeah, and we were talking during the commercial break, Mr. Wallace, that you worked in this health field and you saw the cracks in the system and where there were gaps. And now in retirement, you've created this organization and along with your partners to really fill those gaps and really just help those who need the most help, right?
Correct. And because we know that traditional healthcare systems sometimes don't address the real needs of Black and brown men. And so our services are uniquely tailored for that targeted population.
Yeah. And Dr. Wallace, how are you creating a new model of care for men of color, as your father just mentioned?
Absolutely. You know, what I would say is innovative in a sense is we're actually working with the system. Oftentimes you see a new clinic pop up and it's independent, but we're intentionally working with those systems that our tax dollars are going to, because they, in collaboration, how do we improve that way that they're working with us, people of color? And so we're doing more than just a referral process. We're actually a part of that journey for our clients, whether they're going for primary care, specialty care, whether they're being directed for behavioral health services, or even social determinant support. We're actually a part of that journey with the unique type of agreements we have with our partners.
Wow, that's incredible. And Mr. Wallace, can you share more about your care coordination and patient navigation model?
That's a huge part of what we do. Typically in healthcare, it can be very impersonal. We recognize that in order for us to meet the needs of our population, we have to first of all create relationships of trust. Our tagline is care you can trust, and it starts at the beginning. And we walk through the journey. And so the care coordination is we take every step with you in this journey. We follow up with you. We make sure you get your appointments. We do the scheduling. And after it's all over, we come back and ask you, how did it go? Because it's really important that we live up to the promise.
Yeah, and you build that trust with your clients as well. I love that. And Dr. Wallace, the clinic uses a payer of last resort system. Can you kind of explain what that is and who this really helps?
Absolutely. Look, nobody can do it all, and we shouldn't try to do it all. Through the partnerships as discussed, then we're able to use funding we're getting from grants, funding that we're getting from some of our partners to be able to utilize financial assistance and support where some people fall through the cracks. They still can't pay the copay, even though they're on a pay scale. They don't have the funding to be able to buy prescriptions and other things. So we're using that funding that we're able to really reallocate because we're using our partners and working with our partners who already have those expenses. So it frees up the ability to really take care and hone in where people just need that additional assistance.
Yeah, and that's incredible that you have this service, if you will, to be able to help your patients, your clients that come to see you. And then I also really want to hear more about your unhoused and diversion program that you also offer. Can you tell us more?
Yes, so that actually started through a collaboration with Austin Echo. And so we created this diversion program where the funding is open to men of color, their immediate family, and those with extenuating circumstances, where we're partnering with different type of housing places and locations. So we provide this one-time funding of getting them into housing or food or whatever it may need to be, but we also provide this health plan with them. We bring them in as clients, and we're working in collaboration with that apartment place, that hotel, wherever it may be, to ensure that those stresses from being unhoused, those stresses of potentially being unhoused, how are we supporting them and making sure those stressors do not have other types of impacts?
Wow. Well, the work that you guys are doing is truly life-changing and helping so many people here in the Austin community. I'm so excited to see where you guys are 1 year from now. I just know that you're going to be able to spread those wings far throughout the community and beyond. So, Mr. Wallace and Dr. Wallace, thank you so much for joining us this morning on We Are Austin. Where can our viewers go to learn more?
Our website is listed, is posted. We're also on social media, and so our team does a great job in making sure that you can find us.
Amazing. And for more information or to apply for the CBS Austin and Telemundo Austin Community Partner Program, visit cbsaustin.com/community partner. This Community Partner Spotlight is sponsored by RBFCU. We'll be right back after this. Amazing. You guys did so